Okay, so we're going to be talking a little bit about gua sha. So as you can see, there's a different array of tools. There's this, what we hope is real jade that you can get on Amazon. You can see it's curved. It also has some beveling here that you can kind of get into like the spine area, and then a larger curved surface, and then a tighter curved surface to get like a more general area, and then to get into the more specific tighter spots. And I'm going to demo this in a moment. And then you've got a couple of Chinese soup spoons. I would highly recommend getting the porcelain ones rather than the plastic ones because they have less of a sharp edge. It's much softer and smoother, especially one like this. And then over here you have an antelope horn, which can be used, and I'll demo that in a moment. And then this is just a very common plastic tool that you can use. Other tools that you can use as well are like mayonnaise jar lids or pasta sauce jar lids, as long as it's metal and rounded. So you'd want to use the top portion. So here we have some the oil that I think is really excellent for gua sha, which is 7 Stars Heart Dragon. This is something that Daniel Scryer and I make. So I'm just going to put some on the area. This is just a basic demo of the technique. So you want to lubricate the area. It doesn't matter if the person has a little bit of body hair or not. That's okay. If you put a fair amount of lubricant on it, it will be more comfortable and it won't pull. And you don't want to rub it in to the point where it's fully absorbed in the skin, because then it's going to be less lubricating. All right, so you want to get this area up here. Okay, so we're just going to show you this top area here. There we go. So you always want to tell your patient what you're up to. It's like, okay, I'm going to be doing this technique called gua sha. It's really good for clearing wind heat, for clearing wind. To some degree, it can be useful for wind cold, especially after cupping over the affected area. So if someone's coming down with a cold, or dealing with the flu, or dealing with any kind of respiratory issue. It's also excellent for musculoskeletal issues, because what we're going to be doing is moving the qi and any stagnant qi and blood that's trapped in the fascia, the space between the skin and the muscles. And so, again, you can use a variety of tools. You want to use whatever one is most comfortable for the patient. So you can go old school like the antelope horn, right? Scraping like this. It's good to stabilize the patient with your other hand, okay? Again, I really like the Chinese soup spoon. You can also use this, like if you want to get over, there's a little beveled edge, you can get over the trapezius muscle here. And then if you want to really dig into, like, say, the supraspinatus, you can use the finer portion of it to dig in there, okay? But I'm going to go back to the soup spoon. So it's a slight scooping motion, so it's not a full scoop, but it's just a little bit like this. You want to do about maybe 3 to 5 inch strokes, and it's not, banging in and then scraping. It's a real smooth motion, right? So you want to consider the comfort of the patient. I go over an area about 10 to 30 times. And you want to let your patient know, okay, if I'm pressing too hard, let me know. If you've had enough, let me know, right? If the area is starting to feel sensitive, let me know. And again, this is gua sha, scraping bruises. And the Chinese character for sha includes the disease radical, which means it's drawing up something that's pathological. And then it shows the little sort of sub-character for sand, but not just any sand, but the sand that you find where the water washes up onto the beach. So it's that real granulated sand, which is different than the dry sand. So as you can see here, some sha is coming up pretty quickly. I'm not pressing really hard, maybe about 6 to 8 pounds of pressure. And if you can see here, there's a little bit of like petechia. That's the sha. So once that starts to come up and it starts to get about this level of redness, this is a great example, right? That's when you can stop. You don't really need to go over any more of that. Now, there's a couple of different ways of doing this. You can really thoroughly go over like the whole area, But if you're treating somebody more than once a week, like say 2 or 3 times a week, it can take 2 or 3 days for this to, for the body to distribute it and dissipate it. So if you're going to be doing it multiple times, what I would suggest is go over an area, leave some space, and then go over another area down here, because then like 2 or 3 days later, you can go back to this area. But if somebody's dealing with an acute condition, an exterior condition, or they're in considerable amount of discomfort, then just go over the whole area. And then the next time you see them, just do some like gentle, very gentle cupping, gentle massage or tweenah, right? And you want to go, from top down and from medial laterally. Now, normally, but I don't want to disturb his necklaces, but normally when you're doing the neck and the upper part of the neck towards the head, when you get to a few inches below the occiput, oh, thank you, you can, move the hair out of the way. Oh, thank you, sir. So the way to get up into the occiput, especially if people have occipital headaches, is you start 2 or 3 inches below, right? Get a little bit more oil on there. So it's more comfortable. You would start about 2 to 3 inches below, stabilize the body, and then go upwards up into the occiput. So you want to feel where the occiput is, and then go up into that. And that's really great for these extensor muscles. People who have headaches, migraines, any kind of headache really. It doesn't have to be occipital headache, right? This helps to relax the extensors. And as the extensors relax, often to some degree the SCM and the scalenes start to relax. So you can get up in there like that. If you're going to go over the governor vessel line, be really gentle, because some people have more protruding vertebrae, so that can be uncomfortable as you're kind of like, running over that rough area. And then once you get a little bit lower, then you would again move downwards. You can have the patient tilt their head just a little bit forward. You can even support that if you want. Because again, when you're pushing on a patient, you don't want to be keeping just pushing them around. You want them to be stable and supported. So you can see I'm just using this gentle, slightly scooping motion. And when it starts to get red, I move over a little bit, get to another area, let that rest. And then I come back. So here's the governor vessel line. So I'm getting right up into those muscles, just lateral to the governor vessel line, stabilizing the patient. How's that pressure?
Great.
Great, okay. And then once the Sha starts to come up, then I move on. You don't want to, if I keep going over this area, you'll get breakthrough bleeding. You don't really want that. So here's an example of a lot of people have like moles or some kind of skin feature, right? So you don't want to gua sha over that. So what you can do is you can put your thumb over it and gua sha around that, right? And that keeps you from, possibly injuring the body, injuring your patient. So again, you kind of go up into the occiput and then go back down. Again, from medial to lateral, from superior to inferior, right? He's got a lot of Sha because he's a hardworking guy. All right. And then again, feel around for where the bones are and just be really careful about when you go over that. And if you're going to go over the bones, like here's this scapular spine, you really want to make sure that you're not pressing super hard on that. You can go along just underneath it, into the muscles, right up against the muscles. So here's the medial edge of the scapula and the scapular spine. So you feel for that, stabilizing your patient. 3 to 5 inch strokes, right? As you can see, the Sha is coming up pretty good. There we go. So always feeling for, what's around so it's not uncomfortable for the patient. As you can see, there's quite a lot of Sha coming up. right? And once you get the basic muscular area, then you can get into the smaller muscle areas. So here's the infraspinatus. So getting into that, right? You can even use the more pointed aspect of it to really get into these deeper muscles. It can be very tense. So this is good for muscular tension, muscle aches, muscle stiffness, tight muscles, right? As well as acute conditions, exterior conditions that are affecting the skin and the fascia, which, again, if it's wind cold, that can make things stiff and tight and uncomfortable, right? So, and also, as you're stimulating the wei qi is very yang in nature, and that's very warming. So it also summons that wei qi up and pushes out any external pathogenic factors, and it's very warming, right? Because again, when we're sick, we generate inflammation, we generate a fever. That's to kill what we now know are like bacteria, viruses, right? So as you can see, some shas coming up there. So you don't want to overdo it. This is about as, that's some pretty intense sha, right? So you don't want to do it any more than that. And then once you're done, you want to make sure you cover this area pretty quickly. You wipe the excess lubricant off, which you can use again. Our oil, which is really outstanding for this. It also has a lot of herbs in here for moving stagnant blood and qi and warming the muscles and nourishing the muscles. But you want to make sure that you wipe off the excess oil. You can also use massage cream or even olive oil, something like that, or grapeseed oil is very good. And then keep that covered. Make sure they keep it covered, and have them avoid taking any kind of like soaking baths for at least 12 hours. And there you have it.